Yeah.
Okay, fantastic. Okay, so at this point, I think we can start the celebrations proper. Yep. I'll hand over to the Vice President, Dr. Kelechi Ken-Sylvester, and the Assistant General Secretary, Nusra Adedewe, to lead us into a celebratory mood with a conversation with our pioneers and pathfinders. Let the meeting start.
Okay. Thank you. It's a great pleasure that the 40th anniversary of the Nigerian Association of Medical Physics has provided a platform for reunion. I mean, it was so interesting listening to our founders, our pioneers, cracking jokes and, making fun. Every time it's not about the deep physics. Sometimes we also find time to relax. So it's a great pleasure that we are having this conversation. So let me officially say good afternoon, distinguished guests, colleagues, and members of the association. Particularly our founding members, we are so grateful because if you weren't there, we wouldn't be here today. So it's a great honor to welcome everyone to this special panel discussion, that marks part of the 40th anniversary of the association. And obviously, this is a milestone that reflects resilience, vision, dedication to advancing the profession in Nigeria. So today's session brings together the founding members of the association, like I earlier said, and as well as the frontiers. In other words, experts that are looking forward to advancing the cause of NAMP. So I want to assure us that this conversation promises to be engaging. I mean, it's something that we all look forward to. And on that note, permit me to recognize the following, and maybe briefly we'll give a bio about each of them before we move fully into the conversation. Yeah, in the order, not necessarily in the order of the founding members and the pathfinders, just in the order of the photographs, the photo shots on the flyer. May I ask, or may I recognize, later we would ask if to really know who is on call. So may I recognize Dr. Joshua Audu, Professor Fatai Balogo, Professor Bamidele Awojoyegbe. Sorry, I mean, there are some names that are really hard to be tutored, so peradventure, I didn't pronounce it very well. My apologies. Then our ever young mommy, Dr. Modupe Oresegun. I enjoyed the jokes that were cracked earlier. Then Professor Thomas Ogunleye, Professor Taufik Ige, and lastly, but not the least, Professor Moses Aweda. So these are our discussants for the panel today, and I'm delighted that we'll have this cream la cream on the call, for today's discussion. I'm sure all of us are getting excited, Yes, so on that note, I would ask the ASG, first to inquire more like trying to let's establish the presence of these dignitaries. These are discussants. Let's be sure that they are all on call. Now, before we take a brief bio of each of them, and we swiftly move into the conversation. So the ASG, over.
Thank you very much, Dr. Ken. Good afternoon, everyone. Yes, as you rightly said, thank you for the introduction. Today's discussion is not just to hear from our panel, we're also trying to capture history and to hear the voices that shaped the association over the years. So on this call, we currently have Professor Fatai Balogun. We have Professor Tom Ogunleye. We have Professor Taufik Igi. We have Dr. Modupe Oresegun on call. We also have Professor Bamidele Awojoyigbe on call. And we're still, Yes. So we have missing Professor Aweda and Dr. J.K. Alden. I'd reached out to Professor Aweda some few minutes back, and he said he was going to join the call right now, but he's yet to join. So do you think we wait 1 more minute or two for him to join, or we go ahead and start?
Okay, obviously we have to go on. I want to believe that they will catch us midway. So we have to go on. So on that note, I crave our indulgence to read a very brief bio of the pioneer secretary of NAMPs. Okay, the pioneer secretary of NAMPs is a first-class candidate. He's a first-class holder in physics, from the University of Ibadan in 1974. I used to have a teacher in those years. He would say something, and the next question is, were you born? And we'll all echo no. Although by this time, I think I'm on this part of the planet. Yeah, but this is a very long time, 1974, first-class graduate of physics. He also backed his PhD from the University of Wisconsin in USA in 1981. And to our younger physicists, were you born? The echo is no. Great. We're having a great honor having him in the house. Then he's a lecturer, or he was a lecturer with the Department of Radiation Biology and Radiotherapy, University of Lagos, from 1976 to 1990. So he paid his dues in Nigeria, and he also served meritoriously as the head of department before immigrating to the States. Perhaps not for greener pastures, but for requested impact, in view of what he possesses. At the States, he served as chief physicist in the Regional Cancer Center in San Angelo, and as well as the director of physics in Austin Cancer Centers in Austin. Both cities are in Texas, USA, and that spans from 1995. He became the president, Pinnacle Radiological Physics Services, from 2008, till 2021. That is about 14 years or thereabout, when he retired. Retired but not tired. He was, and he's still a certified member in radiation oncology physics. And this certification was offered by both the American Board of Radiology and the American Board of Medical Physics. So it's a great honor that we have the first secretary of NAMP in the house. Let me quickly take, I would have asked for a standing ovation, but wherever you are, you might just adopt your cap to this eminent personality. We are honored, sir, to have you on call. And let me quickly introduce Professor Fatai Balogun, who is also a founding member of NAMP in 1986. He backed a bachelor's degree in engineering physics, in other words, nuclear engineering at Obafemi Awolowo University in 1980. Then it was called University of Ife. He also had his master's in science in medical physics and as well as PhD in applied radiation physics. Both degrees were acquired at the University of Surrey, UK, from 1981 to 1986. So that means he came back with fresh blood, and that also transcended to the birth of NAMP. He became a professor of physics in 2002. So obviously, Prof has been a professor for the past 24 years. And he is a fellow of so many international institutions and a member of several national and international academic, technical, and steering committees. Too numerous to mention. Time will fail us to start listing them. But of note is that he was also the pioneering executive director of the National Institute of Radiation Protection and Research, University of Ibadan, from 2006 to 2012. And currently, he's with the Center of Energy Research and Development, Obafemi Awolowo University, Ife. Yeah, just to be sure that I'm being heard, because sometimes you might be talking to yourself in this part of the world, not knowing you've been signed out. Sorry, am I still on call?
Yes, you are.
Oh, great, thank you. So the next person is Dr. Modupe Oresegun, our mommy, and that will be taken by the ASG. A brief bio of Dr. Modupe Oresegun. ASG, are you there?
Yes, I am.
Okay.
Thank you.
Okay, you can go on.
Yes, thank you very much for the introductions. Our personal mommy, Dr. Modupe Oresegun, she's internationally recognized, an internationally recognized expert in radiation and health physics, and she has over 9 years of experience. She has a BSc at the University of Ibadan in 1975, and then she proceeded with an MSc at the University of California, Berkeley in 1978, and then came back home to the University of Ibadan for a PhD in 1986. She has served for 7 years the IAEA in Vienna as a radiation safety specialist and has received a merit award for an outstanding work. But in Nigeria, she has become a director of the Radiological Safety Department at the NNRA, the Nigerian Nuclear Regulatory Authority. And she has also worked at the University of Ibadan's Department of Physics, rising from a lecturer 2 to a senior lecturer, and she has also served as a technical director of the Federation Radiation Protection Service at the university. Dr. Modupe Oresegun has co-authored many journals and many radiation safety documents that has been used for regulatory standards in over 140 countries in the world, and she has published widely in scientific journals. Since 2007, she has been the CEO and technical director of Nuclear Safety Consultants, providing radiation safety advisory services to medical and industrial organizations, including multinational companies. So we welcome again you, Dr. Modupe Oresegun. Thank you for your outstanding work.
Okay, that was a great one.
Also on call,
okay.
Can I go ahead with
Yes, you can.
The audio?
You can. Yes. Take the next person.
Yes. We also have on call Professor Taufik Ige. Professor Taufik Abdallah Ige is a very distinguished Nigerian physicist, as we all know, and a medical physicist and a global health technology expert. He is known for his advancing science and technology in healthcare. He has a BSc and PhD in Ahmadu Bello University, Zaria, and he has received extensive training from IAEA fellowships in Greece, in UK, in South Africa, specializing in medical radiation physics and radiotherapy systems. Professor Taufik Ige has served at the National Hospital, Abuja, rising from a chief consultant medical physicist, where he played important and key roles in development, optimization, and safe use of radiotherapy systems. His academic career has spanned several institutions and several years, and is currently serving as a visiting professor at the National Open University in Nigeria and Federal University of Medical Health Sciences in Funtua. So Professor Ige is the former president of FAMPO, Federal African Medical Physics, the only Nigerian that has been opportune to be a president or FAMPO, and is widely recognized for strengthening radiotherapy infrastructure and access to cancer treatment in Africa. His research and collaborations have addressed equipment performance, workforce capacity, and challenges of delivering radiotherapy in low and middle income countries. He's currently supervising and has supervised numerous postgraduate students, contributing to scientific journals, scientific knowledge, and an external examiner across multiple areas. So we welcome again Professor Taufik Ige to the floor. Thank you, Dr. Taufik Ige.
All right. Okay, that was a good one, the ASG. With us here, I wouldn't know if he has joined the call, but then I need to read a brief of his bio, and that is Dr. Joshua Audu, aka JK. He is also one of the frontiers of the Nigerian Association of Medical Physicists. He had his master's in science in radiation physics at the University of St. Andrews, Scotland, between 1983 to 1985. He also had his way back to Scotland, but this time at the University Teaching Hospital, Dundee, for his PhD in medical physics between 1986 to 1989. He was a grade A, or he obtained a grade A training in medical physics in the UK from 1990 to 1994. And based on his career, he also took up a job as lecturer 2 at Ahmadu Bello University, Zaria, and as well as a researcher at the Center of Energy Research and Training, ABU Zaria, in 1985. Further to his clinical contribution to medical physics, he worked at Ipswich Hospital, Royal Postgraduate Medical School, Hammersmith Hospital, London in 1995, and rose to become the unit head after 2 years. He became the pioneer consultant medical physicist at the National Hospital, and as well as the head of department in 2001, though he started having a conversation with the hospital in 2000. He also served as a consultant physicist for IAEA Vienna in 2007, and as well as with the North Coast Cancer Institute. He worked, when he was on leave of absence from the National Hospital between 2011 to 2013. So it's a pleasure to celebrate Dr. JK, as one of the frontliners and one of the frontliners or pathfinders of the association. Okay, the ASG can go on with the others.
Thank you very much, VP. Dr. JK Audu is not on call at the moment, but hopefully when he joins on call, we'll take his bio again. Oh, okay. All right. Good day, everyone, again. Dr. Bamidele Awojoigbe has a PhD in 1997 in medical physics from the Federal University of Technology, Nigeria, in collaboration with the Institute of Biomedical Engineering and Medical Informatics in Zurich, University of Zurich. He has won the 2003 Young African Mathematics Medal Award by African Mathematical Union. He is a professor of physics and an associate member of International Center for Theoretical Physics, ICTP, in Trieste, Italy. His research field is theory, dynamics, and application of magnetic resonance imaging, and is a researcher of the Center of Vaccine and Drug Development at the Federal University of Technology, Minna. He has held key academic leadership roles, serving as Deputy Director of Academic Planning in 2008 to 2011, and later as Director of Academic Planning in 2011 to 2015 at his university, contributing extensively to institutional development and academic strategy. His current research interest lies at the intersection of computational molecular MRI, digital health, and emerging technologies such as quantum artificial intelligence, particularly quantum machine learning, His work reflects a forward-looking approach that integrates physics, computation, and healthcare innovation to address complex challenges in the modern medicine. You're welcome, Professor Bamidele Awojoyibe.
Thank you.
You're welcome, sir.
Okay. So, do we still have any AGS? Do we have anybody who haven't had the bio?
No,
so
we have a
can
bio of everyone covered. Yeah, we can go straight.
Great.
We can go straight to the business.
Okay. So, distinguished panel of discussants, members of NAMP, ladies and gentlemen, who've come to the long expected time, because for so many of us, as the bear panted for water, so have we panted to hear from the founding fathers of this great and amiable association. So the AGS is going to take this section, but not until I've asked the Pioneer Secretary a question, because I've been itching to hear from him. So the discussion is grouped into, different segments. So the AGS will be taking maybe 2 or 3 questions in this section because of a time constraint. Then we can move on. But the first question is to our distinguished Professor Ogunleye, who also was the Pioneer Secretary of NAMP. And in 2-3 minutes, because we wish we could have all day to listen to our founding fathers and mother, but in 2-3 minutes, Prof, could you please take us back to the early days of medical physics in Nigeria? NAMP has become of age 40 years, stay counting. So what was actually the landscape like when you first started the association? You have the record, sir. Please, can we hear you, Professor Ogunleye?
Yeah, thank you very much, everybody. It's such a very wonderful privilege for me to be part of, first of all, to see this day. It's very, very heartwarming. It could almost get me emotional to just be part of this event. And it's wonderful to see and hear from people that I haven't heard from for so many years, decades, as it were. And first of all, I also want to thank God for His grace upon the association, upon everyone. So those of us who have survived up to this and lived up to this point, and have been instrumental in making NAMP what it is today. The good book tells us that we should not despise the days of small beginnings. 40 years ago, it's hard to imagine where we are now. In those days, if I may say, when we were in school, at the undergraduate level, medical physics was the only anything that we knew about medical physics was very, very minimal, even at the undergraduate level. So some of us came into this profession out of curiosity and seeing that we could apply the knowledge of physics immediately to, to solve humanity problems in the medical field. And I remembered when I was, I think it was in my final year at the University of Ibadan. That's when I had a hint of what medical physics could be. Even at that time, it was more of nuclear medicine, rather than, what we know, the different aspects of medical physics today. And and the only medical physics department, it wasn't even called medical physics at that time, was at the University of Lagos, at College of Medicine, where we had Department of Radiation Biology and Radiation Therapy. And there I was opportune to meet the only practicing medical physicist in the country at that time, in the person of Professor Fregene. So anyway, long story short, I met him. And I told him about my interest in medical physics, and he took me under his wings. And that department was the first, and at that time the only department that practices medical physics in the whole nation, and had a single cobalt unit. And so you could imagine it was very, very small, and there were at that time just the two of us. But gradually started expanding, and we saw from the University of Ife, people who went to study medical physics or some aspect of medical physics, going back into the academics at the University of Ife, which is Obafemi Awolowo University at this time. And at the same time also, there was at the University of Ibadan, there was the radiation protection, aspect of radiation medicine that was also emerging, So so after a few years, we found that there were pockets of individuals in various places of like-mindedness, and we decided that it was time for us to come together and form, a medical physics organization in Nigeria. And that's, I believe, in 19, I'm sorry if I have to do all of this from memory, because I left all my documents way back in Nigeria when I left in 1990. That's about 36 years ago. So I don't have opportunity of looking back into the written records. But 2 years before then, we started meeting, on an ad hoc basis. Myself, Professor Lomo, of the University of Obafemi Awolowo University, and then I think later also Professor Balogun came to be part of the initial group, and also Dr. Oresegun was part of that. So that's what gave birth to I think the organization 40 years ago, when we held the first the inaugural meeting, as well as the first scientific meeting at the University of Lagos College of Medicine in Indiaraba, Lagos.
That was so interesting. Going down history, we are privileged to have an information that is worth $1 million. Thank you so much, Prof. We're glad taking us through that line. So on this note, I want to hand over to the ASG, to maybe take on two other discussants, maybe like two other discussants before we move to the next section. The ASG, please take over. Thank you.
Thank you very much. Before I go to the next discussant, I have one more question for Prof. Ogunleye. Could you please take us or tell us what has motivated you to pursue a degree in medical physics at that time? At that time in 1986, what interests you in medical physics? Looking that it was very new. It was a very new profession at that time in Nigeria.
Yeah, yes. When I think in my last year at the University of Ibadan, there were a in those days, you either study, Mrs. Dr. Oresegun can bear this out. You either study atmospheric physics, because that's what the Department of Physics was noted for at the University of Ibadan those days, or in some cases, theoretical physics, because we had very good, theoretical physicists, Professor Madumezia, and also of international renown. So it was either of these two, and I believe it was in 1973 that one of the graduating seniors in Department of Physics did some work in, I believe, he did some work that involved measuring some cell parameters, maybe some resonance of blood cells and so on and so forth. And this was really celebrated because it is in collaboration with the hematology department, of UCH at that time. And so that gave us the hint that, well, in this, you don't have to be an atmospheric physicist or a theoretical physicist only, that you can immediately, you can go into other areas of physics, the applied physics, as it were. So this was what caused the curiosity, and we started looking, into other areas. Then we read about, medical physics as an option for graduate studies, and of course, radiation therapy physics, and was an arm of physics, of medical physics, that was has the larger pie of application of physicists in medicine. So, and I happen to, it was by stroke of, I won't say luck, but just by divine arrangement, that because that I ran into the Department of Radiation Biology, because we never heard about it. It was a new department at that time. I think they were just about 1.5 years old by that time, in 1970. It was established in 1974, 73, 74. So it was not well known at that time outside of Lagos.
Thank you so much, Professor Ogunleye. Very interesting and very good to know. Do we all know that Professor Ogunleye's genuinity for physics goes is very, very genuine, because one of his children is currently a chief medical physicist at the Northside Hospital in Georgia, US. So how many of us can beat our chest and say, all of my children should go and study physics in university? So that's something for us to note. So my other question will go to Dr. Modupe Oresegun. Looking back over the years, what were some of the defining moments that has shaped the growth of medical physics in Nigeria from your perspective?
Good afternoon, all. Permit me to say a few things before I try to answer that question. And the first one will be kudos to NAMP. I'm very proud of, from a humble beginning, how big and how focused the organization has been. And of course, we need to thank the executive, because when you have a good executive, then things do work. So, bam, 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 bam for all you guys. And the sky is the limit. Yes, you're doing so well. I'm so impressed. And I know that you have struggles, but just that nothing worthwhile comes out of doing nothing. It's not 419. You need to put on the effort. You continue to put on and eventually, it could take 40 years. Doesn't matter. We have infinity. There are many birds that have been established, Medical Council, Radiography Council, Engineering Council, they didn't start like 40 years ago. So, and they're going to continue forever in Nigeria. So don't be time constrained. If you attempt to achieve your aim, go on. By the time you're done, it will be established, and then it will meet the objectives for which it was set for. At the beginning of the workshop, or whatever we call this, you had 8 pillars that you projected, and they're all on point. So please keep to your ideology, push on, and you'll achieve success. May not be next year, may not be 5 years, but you will eventually. So that said, I have another thing I want to say. There are 2 of us who started this that are missing on your narrative. Let's say Dr. Jimba, Professor Balogun. Remember Dr. Jimba?
I do.
Professor Balogun?
I do.
Dr. Jimba was one of the pioneers, and he was in where? Was it in ABU?
He was in ABU.
Yes,
Then
in ABU.
He was in ABU. He came from somewhere. He got his PhD or something from some Ivy League university in the US, I think somewhere in Texas, and he joined us. And the few meetings we had together when we were trying to review the Nuclear Act, the NNLA Act, when we were trying to, he was joining us. So I don't know if he's still in the country or not. And the last
yes,
time
he is.
He is.
I spoke to him this morning. He just came back anyway. He just came back from Dubai. So I spoke to him this morning.
Okay. He was working in Dubai. Or he
No. He went to visit the family.
He's lucky that this thing didn't catch him there. Okay. So he is a founding member. I don't know if he's actively involved in medical physics anymore, but he is a founding member. Then we need to mention Professor Lomo. All of you remember Professor Lomo?
Yes,
Okay.
yes, we do.
Professor Lomo was founding member. And
he was the source of NAMP's name. Even that NAMP name was the source of it.
Okay. So we're giving you history. So we don't know we don't know about Professor Lomo, but we know that he's either alive or dead, but whatever it is, the good Lord be with him. So yes, we do need to put him and his contribution to NAMP. So when you're going to, one of the things to take away from this discussion is that we add Dr. Jimba, and maybe one of you can find out what has happened. I know the last time he was working at that radiography school, the NNPC something in exactly. So he's still around. So yes. Okay. So we need to add Dr. Jimba. We need to add Professor Lomo so that this will be complete. Okay. I know I'm not asking your question, but my Wi-Fi, I'm abroad though. I mean, my Wi-Fi is going in and out, and I'm really pissed. And I'm thinking, are they following me? Are the villagers following me? Because if I'm using, your Wi-Fi should not be going in and out. So since I have the opportunity, I'm going to say my piece before I completely lose Wi-Fi, but it's in and out. And then the third thing that is on my mind is, this can be my 2-3 minutes, and then you go on to the next person. The third thing that is on my mind that I plan to mention is about the training and certification. And there was a long discussion online the other time. I contributed, but in my opinion, one of the things says medical physics. For me, from the IEA days, medical physics includes clinical internship. It's a clinical thing. So if you have a curriculum in the university that is just teaching us radiation protection, radiation safety, security, and all that, It's good for industrial application, good for other things, but not good for what you will call medical physics. Medical physicists must have clinical training in the arms of medicine that is using radiation. So radiotherapy, radiology, and nuclear medicine. And you must have internship. Even the IAEA recommends that. So please, one of the things you have to do, if you want to be taken seriously, if you want to do your work well, I know that in the past, we will train people in UI and other universities, and UI is very good. I'm not sure that universities' curriculum or they even have very good people who can teach them, but that one no matter. But if you can have this radiation, nuclear physics, radiation biology, radiation safety, protection, and all that, it's all good. You need it. You can have that. But you must make sure that if you're going to be called a medical physicist, if you're going to be useful in the clinical setting, you need to have attachment. IAEA used to sponsor people. I know most of the people in Ibadan, they were in South Africa, they were in different places. It's important. You cannot be operating in a clinical setting without having clinical aspect of the training. So take that home. As long as you don't have that, I think that's effective as medical physicists. Some of us, I don't say I'm a medical physicist. I'm a radiation safety expert. And I speak with industries, training, teaching, agriculture, all those things. But I would not say I can go to UCH and help them to do dosimetry for patients. I would not say I'm going to go to UCH and calibrate their cobalt 60 or go to Luz and work with the linear. No, I don't have that training. I know what needs to be done in terms of the radiation safety aspect. I would say our doctors should have this training, radiographer for this should have this training. I will have that. That is the radiation safety aspect. But I'm not a hands-on physicist. I cannot do that. I cannot use a simulator. I cannot, all those aspects of the clinical, I cannot do it. So we do need to recognize that and understand that as long as training doesn't involve that, you're going to have people oppose you in wherever you're taking it, maybe Senate or something. Because if I'm in Senate and then you bring a curriculum and you want this to be approved for medical physicists, and maybe I've been abroad before, I'm going to ask you, why is this person a medical physicist? He didn't do any training anywhere in the clinical aspect. So please, if you don't have that in your curriculum, you need to put it. The other time I was asked to help to review a program in which a university wanted to do medical physicists. And I told them straight, this is it, what you have is good, but you are missing the aspect of clinical training. So I think those are the things that give my mind like that, and I've spoken it. So please, that's it. So if we can come back to my question if you have time. I'm going to give the floor to another of the founding members because I think I took about 10 minutes or so. So pass on my question, give it to somebody else. And if there's time, you can come back and ask me something else. But I wanted to contribute what I had in my head, and I did so. Thank you for listening.
Thank you. Thank you so much, Dr. Modupe. Thank you. We've captured that there is a key importance. We have to prioritize and put more effort into the clinical trainings in medical physics, and it is beyond radiation protection, radiation safety. Medical physics is more of clinicals. Yes, thank you very much. We take that, and we'll also use the opportunity to recognize the pioneers that are now on this call, Professor Jimba and then Professor Olomo, who have been pioneers of NAMP. We appreciate all they have done to the growth of the association over the years. So moving forward, I would go on to ask Professor Fatai Balogun. I would like to ask you, how did NAMP structure evolve to support the medical physics profession over the years? Sorry, I have cold. But I don't know if you got my question. How did the structure of NAMP begin to evolve over the years while maintaining medical physics profession?
Thank you very much, Madam AGS. I want to join the last speaker, Dr. Mrs. Oresegun, in congratulating the Medical Physicists Association, especially the executives, as of the current executives. Thank you very much for organizing this program. I want to say that we've already gone through quite a lot as medical physicists. I take myself as a medical physicist because that's what I studied. I may not have been clinical, but all my training has been in medical physics, not just radiation protection. There are those of us that are in the academics. What we teach is not just radiation protection, ma'am. I want you to look at the program in Ife since 1983, I think. We've always had a very robust medical physics program. Of course, we have to have the clinical ones. And Professor Ige will tell you that in NAMP, we've tried this clinical exposure for our candidates. The situation in the country discontinued that program, and I'm sure Professor Ige has more information on that, and he will be able to tell us more. Medical physics has gone through very many, has contributed a lot to the progress of the profession in the country. Just like Dr. Mrs. Oresegun had just said, without NAMP, there will be no NNRA. And NNRA knew very well the importance of medical physics in the country. Dr. Mrs. Oresegun will remember that during my time in the institute, the reason why we started the bill on the establishment of the Council for Medical Physics was the fact that the NNRA tried to register some radiotherapy units, and they found that they are not registrable. And one of the major reasons they are not registrable was the lack of medical physicists. And that's why I was asked by the then DG to coordinate the writing of the bill. And Mrs. Oresegun was part, Professor Olomo was the chairman, and many other people. Pardon? Many other people were there, that I'm not able to mention their name now. And we succeeded in putting up that bill and sent it to the headquarters in Abuja. Professor Ige will tell us the detail of what happened to that bill and how far it went. But when I became the president a couple of years back, I tried to wake up that bill, and it went to the Senate, went through the first reading and the second reading. To go past the second reading had been a problem. And we have been pushing that even after leaving the presidency. I've continued to push on this. But there's always been this inertia in accepting the profession within the Nigerian system, either within the health sector, even in the National Assembly too. There are a lot of inertia there. But I believe that we will get there one day. I remember a number of times I had to go to the National Council for Establishment in Uyo, we are in the north, but it's somewhere in Borno State or thereabout. And then in Ed to defend our antagonistic stand of many of the other people, especially in the medical sector, was impossible. We had to go through a lot of arguments, etc. Even there are times I start to shed tears for the profession. I think I want to employ the current the current executive not to give up. I think we will get there. No matter what they do, we still get there. Because without medical physics, there's no radiotherapy, no nuclear medicine, even the radiology, even the diagnostic sector. Without medical physics, they are just bombarding people with radiation. Please don't be discouraged. Keep going. One day we will get there. Thank you. Oh, are you hearing me?
Yes, sir. We heard you very well. Thank you very much.
Okay.
Thank you for the word.
Thank you very much.
All right. Thank you, Prof. That is the immediate past president of NAMS. He has spoken from the place of experience. Yes, part of our conversation today is the progress, the way forward about the NAMP bill. Yeah, the bill to establish NAMP, because as it stands today, the profession seems to be on the back stage. But we'll look at it. But before then, because of time, I think AGS, we are going to be a bit faster. Maybe for each of the sections, we just take a question and we move, or maximum 2. Just take 2 questions. We are good. So we are looking at the challenges during the formative stage of NAMP. You know, quite a lot of challenges were there, and I would like to, and the challenges also extended. It also extended, you know, not just at the formative stage, beyond the formative stage, there have been some challenges. So I'll be inviting Dr. Ige to talk about the challenges of marginalization and dichotomy. You know, marginalization and dichotomy, because obviously in the medical industry or in the hospital, as it were, you would expect some antagonism. Some are stage managed, some are inherent, and sometimes you might not be able to explain some other challenges. So, Prof, what would you say as part of the challenges, you know, of NAMP, in the growth of the NAMP, vis-a-vis marginalization by other professionals, as well as dichotomy, you know? So what would you have to say, you know, with respect to that as it affects the growth of NAMP? Professor Ige.
All right, thank you, Dr. King. Permit me again to say it's indeed nostalgic, you know, to be here this afternoon, having tried to put this together over this number of weeks. And again, to congratulate the current exco, perhaps trying to move the narratives forward. The question you did ask, you know, I hope I come back to the main one I want to speak about. But believe me, yes, one can see it, you know, a little bit, feel it. But I want to say that on our own paths, particularly when I was coming into the health industry, from the university, because when we were starting off National Hospital, way back 1999, about 10 of us were recruited all over the country. Apparently, I was the only physicist in the team. About 3 radiologists, there were 2 radiotherapy, Dr. Olasinde and Dr. Oresegun. There are 2 engineers and then 3 radiographers. Just 10 of us, essentially. Of course, one came into the industry with a little bit of some, may I say, respect, because they had to search for me, at least somebody that fits the bill in the northern part of the country. And I remember sitting down with some highly respectable clinicians, from the north, trying to convince me, that you need to come. We couldn't find anybody around here. Yes, and by the time we started off in 2000 at the National Hospital, just like I said, I was the only physicist in the team. So by the time the hospital started off proper, options were given, whether the colleagues that were brought together at that time, whether they want to stay or they want to go back. But in my own case, they say you cannot go because you are the only one. And I reckon 2 of our friends and colleagues, Professor Olasinde and then Professor Abdurrahman Tahir of Maiduguri, they opted to go back, and 8 of us were left, to start the job. Because of the nature of recruitment that time, like I said, permit me to repeat myself, there is a bit of respect, and then when one is coming into the hospital, I think I came in then way back 1999 as a senior lecturer. And most of my colleagues then too, they were all senior lecturers. So, but I know in terms of this thing you are saying, I want to say that I've seen it, but I've not really feel it as it were. Because I remember the consultant, the body of consultants, the MD Khan in the hospital then, particularly one of their pioneer chairman then of blessed memory now, used to try to invite me, that you come around, this, that. I said, look, I don't want to take any shit from anybody. Don't tell me I'm not a medical doctor. I know what I'm, So, he invited me severally, but I maintain my stand, I don't want, because it later came to be this thing you are talking about. I refuse to go to their meetings and everything because I know it will get there, one day. And if I'm not able to contain myself, it's not really going to be too good, So we started the job, and of course it was clear there isn't any, you can't do the physicist job in the hospital for heaven's sake. You can't just. You don't have the requisite skills, to be able to do it. And then I reckon that time we had the first linear accelerator in the whole of West African region. So I have to really try to convince my colleague, Dr. Audu, probably to join me in National Hospital then. And he did. He's coming around, gave me some opportunities to do some few more things, as we go along. And things run fairly smoothly. They were able to get some younger colleagues along the line. But 10 years down the line, of course, my fear came up, and that's probably we were being paid, the 2 level of MD Khan's ESCO has gone then. Some of the new Atatoks, as I was going to call them, felt probably we are not supposed to be paid the salaries of doctors because we are not doctors. Of course, it wasn't properly handled, because when I started getting the feelers of where the problem came, my colleague actually didn't take me along. And this was very bad. For almost over 1 year, we were not paid a dime because of this. In fact, there's some threats then that probably we may need to do some refund and all that, But this is the downside. And that's why I said initially, the respect was there because the manner in which we came in, they have to search for us and everything, But at a stage, when this came about, luckily, one is able to have some contacts in the presidency here and there, and they have to restore the salary much later. Oh, that's over a year. I told you we didn't collect a dime, me and my colleague, for this incident. It was then it became obvious what the other younger colleagues are going through in the various institutions, the lack of recognition and all that, But when the federal government was going to start this radiotherapy expansion, of course, it became very obvious again that who are this group called the medical physicists? Machines were put together, the other professionals were there, machines were installed, and then because of the lack of the power situation, which we are still going through today, those 4 facilities were built around diesel generating engines. So you have, in a particular situation in Benin, that you have to use the big gen, all of them use big gen to power the machines during the day, and then the small gen to maintain the vacuum on the linear accelerator. And this was going on for like a year in Benin, and a single patient was not treated. I can't really forget that scenario at the Federal Ministry of Health, where the then CMAC of Benin broke down and he was crying. Why is this about? They said they don't have a medical physicist. Doctors were there, the radiographers were there, the patients are there. And so it became very obvious again that probably something has to be done about this medical physics situation. Of course, it was properly pursued then by the Minister of Health, Professor Chichuku. I cannot really forget him. But each time we meet in Ibadan for the exams again, say, Ige, what is happening again? What is, And it's on. And then he started the idea of having the medical physics bill as an executive bill, because we don't have the necessary critical mass to be able to push this through the lobbying system in the National Assembly. So let me probably just stop at that. The situation is still the same today. It's really very, very painful. But just like Professor Balogun mentioned, when he came back from Yola, I really pitied the old man. He said, I cried, Taufik. I cried like this. An old man crying. What sort of human beings are these? These are supposed to be an enlightened community. But here we are, our colleagues who are supposed to really help us to push this through. There is no need for any rivalry here, just like one said. We have our job cut out for us to do. But here we are, like probably people are trying to. So this is the situation, Kelechi, and I'm positive, just like Mama said, Dr. Oresegun, it may not happen, but I'm sure probably in our lifetime, before we pass, I'm hoping that some of these things will be addressed and properly put to rest. So that would be my quick experience, Mr. Vice President. Thank you very much.
Okay, Prof. All right, thank you so much. It's painful to say the least, but then it's a matter of time. Most of this will be upturned. So because of time, the ASG was supposed to take questions on training program of medical physicists in Nigeria. I'll just take a question and possibly she will take one on this section and we'll move to the next because there are quite a lot who would love to be discussed. Yes. So ASG, I hope that is okay by you.
Yes, it is.
Great. Okay, now there is a growing concern and a great one for that matter. It's so disturbing that today we have a good number of universities in Nigeria that have been accredited by NUC to award postgraduate degrees in medical physics. I do hope Professor Aweda is on call because I will actually want him to respond to this. Prof, I hope you're on call. And
He's not on call yet. He's having challenges joining for a while now.
Okay, then Professor Awojegbe, I hope he's still on call.
Yes, I'm here.
Okay, sir. Okay, so please, I would want you to respond to this. Quite a lot of universities have been accredited by NUC to award postgraduate degrees in medical physics. Sir, are you worried about the competence of most of the lecturers who themselves are not grounded in medical physics either in these universities, and they are training potential medical physicists? And more so, departments of radiography had also been accredited to award degrees in medical physics. So as a luminary in the academia, do you have any concern? Have you noticed any abnormality with this situation, Professor Awojegbe?
Thank you so much. That is the executive for arranging this very unique occasion. And again, personally, I really thank you very much for that. And I've learned from the history of this beloved association. And I think I will not forget in a hurry what I learned today. Well, it was in 1998/2000, after my PhD, that's FUT Mina/Zurich, Switzerland. So I went to ICTP on a visit invitation, and within that 3 months I spent there, I received 2 letters from medical physicists in US. Actually, I didn't know them. I don't know up to today how they got my email. The letter reads that Dr. Awojegbe, what are you people doing with medical physics in Nigeria? Please, we want you to do something about it. That's all. I actually replied, thanking him that we are going to do something about it. Fortunately, when I came back, I didn't come to Mina Street, that is a Federal University of Technology, Mina. I located I met him before. I went to his office. Fortunately, I did not meet him in the office on that day. Unfortunately, so because of my flight to Mina, I had to leave a note. Well, later we met, actually, when I invited him for external examination of my student, and also he also invited me too. So we now discuss about it. and about a lot of things on medical physics. Well, that really started. I want to talk about what Professor Ige mentioned, and also Professor Balogun. I really sympathize with the experience those two people, they have taken NAMP to their heart. In fact, they breathe NAMP, they sneeze NAMP, and everything about them is NAMP. That's what I will say about those two people. I'm really cry at that level. You know what we are talking about. And also the experience of Professor Edu. Professor Medicine, he said that is it Professor that they have to pass the bill through executive bill, and because of no critical mass. And Dr. Ige also mentions, Professor Ige also mentioned something that they were looking, who are these people called medical physicists, looking for them because they were few. So, having painted that background, which means that we were also very, very few. Then, according to Professor Oresegun and Balogun, I think they were few at the beginning, 40 years ago, maybe they are 5. If I can really remember very well, they're 5 or 6. Yesterday, I called the Secretary General. How many are we today? Either registered or either paying members or no? Those who are registered for NAMP, how many? She told me that we are 280. That is from 5 40 years ago, and now today 280. Today we are 86 listening to this program. So we have done actually quite a lot, and a lot of waters has passed under the bridge. So now to answer your question, let me say one thing again. Because of my position, privilege as academic planning, that's 2009 to 27 years anyway. When UC wanted to reform or establish new programs in Nigeria in the name of CC Mass, they invited me. And I can really let you know that they just gave me what they thought is medical physics. Please, Prof, do whatever you can do to make sure that this course, this program is alive. So they must have discussed it at higher level. That is what I just wanted to know. They at all costs, they wanted to establish this program at undergraduate level. Probably, the third time, probably, because of the bill. I don't know. And some people at the highest level, they may be thinking like people. How many are they? How many universities are running it? Maybe that is why they have to put it, in fact, they said that this must come alive. And then I call Professor Balogun, the president. This is what I had. This is what they asked me to do, NUC. I know what he said. Then I started inviting people outside Africa, Australia, US, the universities that had the undergraduate. Well, what kind of constraints given to us and the instructions given to us and the templates given to us, what we have as systems to ourselves. And they told me, when I was giving this, that, well, if you have any in the next 5 years, every 5 years, each could, that's the life of a curriculum. We can do anything to change it, amend it, contribute to it here and there. But the point is that we want it. I was happy that at least the government want medical physics to be alive in Nigeria. Yes, we have it. And it must be in the Department of Physics. Again, it was stated the doses are messing other departments. And again, internship was there. And 6 months compulsory CWS in an hospital is there. And before a university can really start to operate it, it must be affiliated to a teaching university. A teaching hospital, so that you can have the critical manpower to really train them. So it's all there just to solidify our medical physics. It's 4 years instead of 5 years. It's 5 years instead of 4 years, because you must be a physicist before you become a medical physicist. Therefore, the 4 year is pure physics. You take 1 or 2 biomedical, medical here and there, and the 5th year will be purely on medical physics. So that's about that. So, but for postgraduate, so any university now that want to operate or develop or run medical physics at undergraduate, the condition is there in NUC. Even if anybody, if a Yoruba language man or professor want to accredit, it must follow the NUC mass. So it can't be in any other department except physics according to CC mass. That is undergraduate. But for postgraduates, if I can come to your question directly, but for postgraduate, NUC doesn't have either a law that it must be a particular department. Medical physics, I've not seen it. Whether it is there or not, I've not seen it. Throughout the time I was director of academic planning, juggling NUC, my university here and there. So if anybody want to accredit postgraduate program in a university, they may not see the condition that it must be a particular in a particular department. That may be the reason for that. But as per undergraduates, according to NUC, it must be in the Department of Physics, and the university must have a teaching hospital. That is my...
Thank you so much, Prof. Yes, thank you so much. Really appreciate that extensive it's an eye-opener, and so much information that we are privileged getting from you based on your position. So yes, I'm going to say something, but
can I ask a question? Please, can I ask a question?
Yes, ma'am.
Okay, ma'am.
Okay. So I thank the last speaker, and I'm very much enlightened and happy that there's actually something good that's been set up for the curriculum. I have a question though. You say it's a 5-year program that NUC approved. So what would I get when I finish? I start with a BSc Physics, and then I go on to do the medical physics part, and I like the internship part. So what will be my qualification when I finish this 5-year program? I'm not familiar with the thing, but do you know it offhand? What will be? Will I be getting a BSc, or will I be getting a master's?
Thank you so much for this question. This is a very important question. Before I answer that question, let me just go through my personal experience. I was in AUC some time ago as Director Academic Planning, and I met the Director Academic Planning also in AUC. So he now asked me, he said, Prof, why are your university programs, why are they 5 years instead of 4 years? I said, sir, thank you so much. Am I say okay? Am I say okay?
We can hear you. Yeah, we can hear you. I can hear you.
Okay. So now I said that, okay, he said that, are we not losing students? Instead of, it is some first degree, physics, 4 years, 5 years. So I now told them, yes, our university is University of Technology. University of Technology. And we have, why is it technology? We have industrial placements. That is compulsory for all the students. And that is minimum of 6 months. Minimum of 6 months. In fact, at times, it can be 8 months, depending. So in this case, we are having a medical physics program. And it is a norm that before you become a medical physicist, you must be a physicist first. So the 4 year, we prepare the students with basic medical physics, basic physics, thermodynamics, quantum physics, here and there, here and there, and there, and there. So by the time you are grounded, well grounded, then actually at intervals, you have elective from biology, that is physiology, anatomy, and radiation, and others. So by the time you are now in 500 level, you now take compulsory courses in medical physics, nuclear physics, nuclear this and radiology here and there. You now take courses that will prepare you for the future. That is the point. And again, ma'am. Hello, ma'am. So, and again, another thing is this. Another thing is this, which I must say. The federal government, today, they don't have a special placement for medical physicists. They don't. They lump them with science, whether with physics, with botany, with all those things. So, and why is it? Because there is no university that was running first degree medical physics. And it is the same federal government that is having the two, that is Federal Civil Service and also the universities. If you don't have a program in medical, having the two, that can be.
Sorry, Prof, can I come in at this point? Can I come in at this point, please? Prof?
Please, stop it. The network is buffering.
Okay, thank you so much. Thank you so much. Obviously, it's interesting. You know, the conversation is getting more interesting and it's also getting more engaging. But because of time constraint, I would want us to move to the next. But let me put this as a kind of takeaway. We obviously have programs being run, medical physics program run in the Department of Radiography and maybe some other departments. I think that is an error. Yeah, because there is no way a lab scientist will train a doctor. The same way a lab scientist cannot train a doctor, a radiographer can never train a medical physicist. So, and NUC, for whatever reason, if NUC doesn't have control over postgraduate programs in the universities, and medical physics, by the definition and by the standard of International Organization of Medical Physics, takes effect from master's level, then it becomes a big problem to Nigerian medical physicists and the medical physics in the academia. It becomes a big problem. I think the discussion continues after this point, but I think it also is more of a clarion call for our founders and our pathfinders to actually see the danger that lies ahead when the program is left at the corridor of power brokers who could allow whatever to go on. And I think that goes ahead to water down the likes of our Prof. Ogunleye, who practiced in America, would have quite a lot to tell us about the prospects of this profession. And if NUC, possibly you gave NUC a good white paper, but our concern is that today, what we are seeing in the various universities is, if it's not checked, it's going to lead the profession to a point when the center, the main objective of the profession is defeated, and it becomes like technicians are taking over the job of the medical physicist. So, like I said, the conversation continues, but at this point, I want to make a clarion call to the founding fathers and mother, the pathfinders, the frontiers, everybody that really have so much concern about the profession to wake up, because the profession is being hijacked, and we should correct it so we could also have our place when it comes to Africa and the globe, you know, regarding medical physics. So on that note, I invite the ASG to take up a question. Yeah, because of time. Here now we're looking at professional confidence of the pioneers on the currently practicing medical physicists in Nigeria. Yeah, because if the founding fathers, if the pathfinders do not have confidence in the current practicing medical physicists, then it becomes a problem. And part of it is exactly what we just addressed, in a situation where the university that is producing the professionals lack the manpower because they don't even have those who are experienced, training the medical field. So today, we're looking at professional confidence. So ASG, we might just take a question. If I have time, I might take one in addition. Otherwise, we'll move to the next session. Please, ASG, you can take a question on this section D.
Thank you very much.
All right, thank you.
Thank you very much, VP. Thank you very much, Professor JB and everyone for your input so far. So moving forward, I'll be directing this particular question to Professor Taufik Ige. Sir, we would like to ask if you believe that the current training pathways are adequately preparing medical physicists for the complexities in clinical practice of today. Looking at the complexities of medical physicists in the clinical section, do you believe that the current training pathways are adequate to prepare medical physicists?
All right, thank you very much. I'll switch back a little to the conversation we just had, because it's really very germane and to build onto this question which you did mention. To answer in a way what Dr. Oresegun asked Professor Ojeogbe, it's still BSc Medical Physics. They aren't going to take the 5 years program. I think there's some clarification there. University of Technology actually, around 5 years program. So after that program, whatever it is, it's still BSc Medical Physics. It cannot be anything else. And I know, although I'm not aware when this was being developed, that the intention was actually to widen the base so that we are able to attract more physicists into the profession by starting from BSc. I was part of the author of the IAEA HHS 25 documents. I and Professor Debbie Vandamave were the 2 African representatives on that consultative forum by the IAEA to put that together. And as at then, probably in the whole continent, and that still exists in South Africa today, the BSc, all right? 4 years, but their own internship is 2 years hospital-based. And they have to be accredited by the HPCSA. Unfortunately, probably that's what we actually missed here. So in their own case, spending 2 years in the hospital environment, going through the whole gamut of radiotherapy, diagnostic radiology, and nuclear medicine, makes them, to a large extent, competent. Of course, they have to test them again. I think probably the question of the BSc Medical Physics, instead of jettisoning, looking at it from negative perspective, we should be able to look at it as a progress and then try to see how best to push this forward. Because like Professor Ojeogbe mentioned, the CC mass is a 5-year thing. Probably by the time they are reviewing the CC mass again for the university, we'll have to. I'm glad that this conversation is coming in very early, so that we have to insist so that people are not going away with the impression that probably they spend 5 years, have BSc Medical Physics, and they're competent to operate machines. It isn't going to happen. Unfortunately, I feel that probably, especially the new programs, it may be a little bit difficult, but one has to make the entrants know that this is the situation. And if indeed, using the current balance, if you want to work in a hospital environment, then you have to go a little bit up to the postgraduate level. I'm glad Prof did mention this, Kelechi mentioned this too. For the postgraduates, it's the Senate of the various universities, that determines, that has nothing to do with NUC. For the PG program, especially the MSc Medical Physics in our various universities. We have to debate this in NAEC when we were trying to start the training program of the IAEA way back then. We were the pioneer, the first in the whole of the continent, using the TCS 37 to be able to put together this training program. We started well, 15, it was later cut down to 7 because of what Professor Bilal Mukhtar from Riyadh advised. Now you guys, you are very ambitious, but you don't have the necessary and the critical infrastructure to be able to run this. So from 15 to 7, eventually we have 4 of them left due to funding and so many other crises. I think here one has to mention Professor Ebu Chichuku, for his very, very nice intention and trying to drive this through. Professor Sai of NAEC then, Professor B.B. Shehu of National Hospital, and Dr. Amatu Hassan, who was meant to coordinate this program from the Federal Ministry of Health then. They did their bit, to be able to make this. And the IAEA, of course, brought all the resources that will make this agreed. Some of the younger colleagues then were, how do I want to say, is this overzealousness? But we put that behind. And the thing we did then, all the people that were brought into the field were picked from the hospitals that are already working. I see there are still 4 of them left now, and it's just, and that informs why, way back again, 2015, one has to pay for us as Nigeria to join the IMPCB, because that was just what is left. And we know we have the brain, we have the competence, to be able to get this through. So I'm hoping, plus or minus this bill that is happening, the people who are on the field try our best to be able to push this narrative through. Now back to the question quickly, that the question of competence. Competence is built not only on the brain alone, but able to use the skills on the infrastructure available. Today, we have, I'm not too sure whether the situation, well, one could say that it's improving, but we aren't there yet. Because way back then, machine is down today, machine is only in Nigeria, you have downtime of 3 months, 6 months, even 1 year. It doesn't happen anywhere in the world. Downtime is 1 week max, and you start correcting, But you have 3 months, 6 months, one year, So if the current younger colleagues, a lot of efforts and deliberate efforts must be put, on their own part, one cannot say, because competence, of course, knowledge and skill go together, to be able to build competence, So on this note, I think probably the executive is on the right course, to really assist with the few centers, that are currently operating with no downtime probably for the past 2, 3, 4 years, that we're able to build a synergy where these young professionals who are in the field now are able to get attached to some of these facilities and get the necessary exposure. That would be my quick submission on this. Thank you very much.
Okay, thank you, sir.
Thank you very much, sir. Thank you for the insights. But I don't know if Dr. Ken has further questions, but I'll just like to ask.
Yes. Sorry, it's like what? Sorry,
You can go on.
Okay, I think I'm getting an.
Okay.
Okay.
So, you
What
can
is
go on,
happening?
Dr. Ken.
Okay, Prof. Mr. Wike, I have a question in line with your submission. Sir, I'm getting a hold. Okay, sorry. Can you hear me, Prof?
Yes, we can hear you. Yeah,
okay, good. All right. So, based on context, now we have a sense, because we can't have our own.
You joined the call twice. You joined the call twice. That's why we're having the echo. You can log out now.
Oh. Okay. Sorry. Please just give me a minute.
Well, you need to switch off, leave one of the meetings. Yes, I know why you are doing that. I have a similar situation. It's because of what Mama said the other time. You know, I have 3 systems, yeah, just to, in order not to, but then got out of one of them so that one can, the feedback can actually go. One can then hear you properly. Yes. Have we lost Kelechi?
You can unmute now, Dr. Ken.
Okay, can you hear me?
Yes, you can.
Okay, great. So I have a concern, and it leaves me worried, like, are we actually making progress after 40 years as an association, as a profession in Nigeria? Now, we have a center in Nigeria called the African Medical Center of Excellence. And I stand to be corrected, but the last time I checked, this particular center does not have any indigenous medical physicist. I'm aware of one of us that is the RSO, but I'm not aware of any clinical medical physicist in the team. Now, my worries is it like we don't have anybody qualified as an indigenous medical physicist practicing in Nigeria? Is it like we don't have anyone qualified, to get a job there? So supposedly I see this as an aberration, but at the same time I stand to be corrected. So where did we get it wrong? I wouldn't want to say, maybe is it like the founding, the pioneers and the pathfinders? Is it like they've not really been able to mentor very well that we could have indigenous medical physicists that should take a place in such center? And technicians were brought from Egypt and some other part of the world, and they take up the job meant for indigenous medical physicists. Prof, does it leave you with a concern the way I feel about it? Thank you.
All right, okay, thank you very much, Kelechi. This has nothing to do with science. Whatever has happened in EMC, I can tell you, upfront. Because I, with the South African guy, started the project. I was there, that RSA to that project. All right? The question of bringing in Egyptians, to said it's an African Medical Center of Excellence. That was the argument of the management when they were put together. All right, because I'm aware that at least a number of colleagues on this call today applied, because it was, the call to the recruitment call was given to a UK company, and the criteria spelled out there. Okay, and I'm aware, that at least before I got myself, out of AMCHE, that a number of colleagues applied, for the post. Okay, no, but the argument of the management is that perhaps it's an African Medical Center of Excellence, it's not a Nigerian Medical Center of Excellence. Agreed, that appears to have, if I may use that word, negatively impacted on medical physics in this particular situation. But a number of professionals that are on that facility today are Nigerians. So, but get that thing I said again, African Medical Center of Excellence. And I remember that's what I understand the CMO was trying to say, that it's not a Nigerian thing. So to that extent, you can hardly won the argument, because the CEO is Brian Divas is an American. The next one is a British Pakistani, and then this CMO, who happens to be a Nigerian, who happens to be a younger colleague in National Hospital. But for whatever reason, which I think probably it's not about concern here, Kelechi. I'm really very sorry. But when things get to a stage, becomes political, there's hardly anything probably you can do, because it's not an entirely governmental thing. This is being run by a bank, all right? And they have, except probably you have people who are actually at the top level from our senior colleagues here today who could be part of those management in the bank or at that top level that can say, hey, we need to do it like this. A typical example, if we don't have such kind of high level influencer, if I want to say, influencer is very difficult because they could make any arguments, and they go away with it. And mark you again, I said, it's not a governmental thing, it's not a Nigerian government alone that is running this. So that is that about AMCHE. At least I have one which I was invited to, and I have to really make them realize this is a Nigerian thing. But I'm surprised that that organization is going into a full-blown medical facility, radiotherapy, nuclear medicine, diagnostic radiology. If you see how much money was being sunk into this. But because of these Naira exchange issues, I'm sure probably they will have rolled out by now too. And at least I have a mouth there. I was able to convince, the consultants on the project who are able to speak, because I'm not interfacing with the Director General of because it's a security agency, to say, hey, if you really need hands that can actually do the job, we have them available in the country. And they said, thank you. When we get there, we'll let you know, and you may be able to assist us with this. So that would be it's not everything that one can, but at least to a very large extent to let you know that some of these things are way, way beyond us. If you don't have that kind of high-level influencer, let me use that word, then on this particular case, the rest assured, it's not an argument that can be won. They tell you it's an African Medical Center of Excellence, not a Nigerian Medical Center of Excellence. Yes, and they will tell you we have so many Nigerians who are on this facility working today. So you cannot, it's not an argument that can be won anywhere. So I'll just let us allow it to be, as long as these colleagues, who are doing the job are not endangering the lives of the patients that are coming there. And this is why I felt probably our Nigerian colleague who is on the project is very critical, because he is a very competent person too. And as the radiation safety experts, you should be able to oversee what these African colleagues are doing. And if they are doing anything detrimental, yes, the facility is supposed to attract patients from all over the continent. But I am sure that the preponderance of the patients that are going to be identified to there are from Nigeria. So if there's anything detrimental that is happening there that will impact negatively on the lives of our patients, then you should be in a position to at least help in trying to bring this to the attention of the association. So that would be my submission on this again. Thank you very much. It's concerning, but the truth about it, not like I've said frontally, is that it's not an argument that can be won anywhere. Thank you.
Okay, thank you so much, Prof. I can only wish that things turned out differently. A place where radiologists, radiation oncologists, radiation therapists will have indigenous representation, but the medical physicists were schemed out for whatever criteria set is disheartening. I just hope that can be corrected in the nearest future, because that would also be an applause to our profession in the country. Yes, I think we might not go further with more questions, except like we're winding down now. We're looking at the time. It's been a great time, but at this point, ASG, I really want to, plead that would, wind this down because we've already spent 2 hours on call and we should respect people's programs. Maybe as we wind down, I would want to give opportunity to 2 persons, from the call, members of the association, who would want to ask question. I've checked, somebody was asking difference between medical physics and radiation/health physics. That question, if it can be answered by maybe one of our discussants, but now let me give opportunity. That question can still be taken in the course of responding. Now, please indicate 2 persons you want to have a question for any of the discussants, Now, if we take that, then we can have the vote of thanks. We want to have vote of thanks from the president, remarks from the president, then we can.
May I appeal that we have just 2 questions for our discussant that are very critical for today's discussion. You can just ask 1 or 2 questions from Dr. Oresegun, Prof. Ogunleye. That would be really interesting, especially in terms of training. Before we go into questions from the participants, and before we take their final words.
Okay, that is fine.
Yeah, so Dr. Oresegun, yeah, I wanted to ask that some years back, we started the residency program, and it was unfortunately abrupted for some reasons. Do you think that partnerships with organizations like IAEA can be leveraged to resuscitate this residency program? How do you think we can partner with IAEA and other professional bodies to resuscitate the residency program in Nigeria and to build training and capacity building?
Thank you. I know at the beginning, IEA was helping. I'm sure Dr. Ige, you did say they went for training. It was very common in those days. That you finish your... Can you please unmute?
Can you please mute?
Yeah, so in those days, you do training.
Remove him from the call. Remove him from the call, please.
I've muted him. You can go on, ma'am.
Okay. In those days, you did training in Nigeria, and there were not enough places to do your internship, and IEA would send you. Some people went for 1 year. So even the nuclear medicine guys in UCH, Yubosa will tell you, they went to South Africa or somewhere to go do training. So of course, the government can ask for assistance, but it's more important, in my opinion, that a university liaises with the teaching hospital or with a good hospital, better a teaching hospital, and then they form a curriculum together and they ask for permission of the Senate and they run the program. And for me, medical physics comes with internship. That is what IEA recommends, and that is what makes sense to me. So anyhow you can get it, either IEA is assisting us, sending people out of fellowship, or internally, the university, the physics department, and for me, I don't understand how medical physics can be in the radiography department. I don't understand that. For me, it's a physics course with specialty in medical physics. So for me, it's okay to have the BSc physics and then have a 2-year or 1 year or 1.5 year program postgraduate. Because if I spend 5 years with a curriculum, I don't want to be paid at the BSc level. Nigeria is different. Everybody, you enter into civil service curriculum. So if I spend 5 years, I don't want to be slotted in with geography, BSc geography that spent 4 years. Nobody cares the specialty. They will just say you are BSc holder. We like degrees. So if you want, for me, to go into a course like this, I'll do my BSc physics, and then I go to a postgraduate course of medical physics, which should include internship. And then I come out, at least I can start somewhere. in the system. I will not be starting at, we used to call it USS 8. I don't know what it is now. I won't be starting at BSc level after I've done 5 years university. When doctors do 5 years, they get a higher degree. I don't know about engineers, but definitely I don't want to do a 5-year course and still end up with a BSc and be slotted with a BSc person English. I think it's not fair, and I think that we don't need to do that. What I'm saying might be too simplified, but definitely medical physics must start from physics department, and there must be internship. If I can add in what I think of what is medical physics and health physics. Health physics, another word for health physics is radiation safety. There used to be a health physics society that we used to subscribe in those days. They changed their name to radiation safety. So if you're not having the medical part, the radiation safety as expert, that's what I think. But if once you do the medical part, then you are clinically competent. And then for me, you are a medical physicist. Except things have changed. But when we were doing the curriculum in IAEA, it was not to be left alone to a theoretical part. You do theoretical part, and then you do hands-on. How do you do treatment planning in a university? How do you do those things in a university? No, you must go and have internship. That's my opinion. Thank you.
Thank you very much. Thank you very much. That was very insightful. The final question will go to Professor Tom Ogunleye. What advice would you have for NAMP for the next decade? Apologies for the noise on the background. But for the next decade, what advice would you have for NAMP? What would you say we should do going forward for the next 10 years? Now that we're at 40 years, by the time we're 50 years of age, where would you like to see the profession on the global map?
Well, thank you. Can everybody hear me? Because I'm.
Yes, we can.
Okay, I had left my location, so I believe that there's a lot of things that we are juggling together, and that comes with growth, and it is rightly so. The issues that we've been listening to, that has been discussed ever since we've started on this program, there are some of the issues that will come as a result of growth and development. The problems we are facing and the challenges, they are supposed, they should be expected, they should be anticipated. So but the first thing that we need to bear in mind is that we should have a clear-cut goal. Where do we want to see ourselves in the next 10 years? First of all, the recognition of this profession as a viable part of medicine or in the medical healthcare arena needs to be recognized, because we have lost. I can see that we have lost some, recognition, as it were, over the years. When we started, there were just very few of us. We were appointed as consultants, to the hospitals because we were in the academic area. We're just as physicians were being appointed consultants, even though we were paid, half of consultancy fee to the hospital, but we were recognized as consultants even in those days. So, and there will be resistance from, as we are already seeing, there will be resistance from our sister societies, the physician groups. But if we want to move forward, we have to recognize that even though there's resistance from them, we need their cooperation to move forward, because of the clout, because of their position, because we do not operate, we do not stand alone even in our own organization. So we need to be patient and find when friendly groups of people will come in, both on our as support from the physician groups, as well as people in the Senate or whatever the the governing body that will enact these laws. So let's be patient. Let's not give up, but we have to be determined that and establish our own goal line, that this is where we want to go, and we will not, give up until we cross that line. People go and people come. What we see today is not going to be there forever, and so that resiliency needs to come up, and we make sure that we do not, diffuse our vision by watering, because you can only if we panic and we say that we need to expand our base, we need to expand the profession and start to some extent diluting the quality. We will suffer as a result of that. So it is very essential for us, to make sure that we, as much as possible, control what we can control, maintaining a high quality as we put them down, even if we cannot implement them right now, but we have them written down so that we know what we want to accomplish without necessarily having to settle for whatever comes our way. So it is very crucial for us to think about this precisely. I'm not very familiar. I may also mention that I'm not very familiar with the baccalaureate program for medical physics, so I cannot say too much about that. But my experience, both in the UK and in the USA, medical physics is a graduate program. So even though you can have physicists, coming in fact, in some of the programs here in the USA, they just require you to have physical science, to have strong background in physical science. So you have people who studied chemistry and going into graduate school to study medical physics. You have people who studied engineering going to graduate school to study, medical physics. And of course, they become if they want to be clinical, they have to go through residency programs and so on and so forth and be certified. This is what I want us to articulate very, very well. Now, if you start producing BSc, you also have to look at the future. We may think we have enough people on ground now. We have to project to the future. You don't want to overproduce. Just as you don't want to have too few, you don't want to overproduce, because when you overproduce, you have problems. I also would like for the body, for NAMP, to have some input into this curriculum that is being developed at the bachelor's level. What it will impact, what will be the impact in the future? Do we have enough people coming in from pure physics degrees to enter into graduate programs in medical physics? If we have enough, I believe that will strengthen the program. Except we are able to come up with a career pathway where, if you have somebody with bachelor's degree, before he becomes certified, in fact, certification will require a higher level of degree, at least master's. So, but maybe a junior physicist, is established. Junior physicist positions are established in the various departments so that these people can be absorbed into them. Otherwise, you don't want to create programs where people upon graduation, you don't have a master's degree, they are not ready for internship, and they are and they're not employed at the level that they should be. So these are some of the things that we need to continue to look at and push forward. Resilience, let's not give up. We will meet with roadblocks. Let's remember that the crop of people that we have today are not necessarily going to be there tomorrow. And tomorrow we have somebody who is very friendly to the medical physics profession, or even a medical physicist being appointed into a position of influence. I remembered when the senior advisor to the Minister of Science was a professor of physics, and that gave rise to a lot of opportunities to many areas of development in the sciences. So let's not give up. Let's focus on what we are doing. Let's focus on our quality, and let's be resilient in what we're doing. Thank you.
Wow. Wow. Thank you so much, Prof. I honestly can't get tired listening to you, because everything you said is apt, is giving a compass. Like the advice is taken. Thank God that the meeting is recorded, so we can always extract, because it's also going to help the association. Yes, the advice, I must point out that the association, should also make a strong input in determining the pathway for the profession. I think that we would take seriously. We're already taking steps to ensure that the profession is not hijacked. And the advice from an elder statesman, our father in the house, is a whole lot of encouragement. Thank you so much for that. And I think at this point, I was going to make requests for like maybe 2 persons to ask questions. I don't know if we'll still have that time.
Yeah, we can.
I would have loved. Okay, we can take questions from 2 persons. Then we'll have remark from the president, and I will give the closing statement, and that will be all for today. There are quite a lot of other programs lined out for the 40th anniversary of NAMP. So, but for today, it's been a wonderful time. But as much as it's been pleasing, we wouldn't want to keep everybody, beyond necessary time allotted. So, the ASG, maybe you can ask for the 2 persons who have questions, and we'll get that sorted out. Thank you.
Yes, thank you very much. Thank you, everyone. We just have allocations for 2 questions. Obi Victor, could you speak? I see you have a question in the chat box. Can you unmute and read out your question?
Good afternoon, everyone. Good evening, sorry. I think it's evening already.
Good evening.
Good evening, Doctor.
Yeah.
Good evening, Prof. And good evening, every panelist. I am very, very honored to be on this call with some of the most distinguished names I've heard in years, only to see them today, at least on the platform. Thank you very much for making yourself available. My question goes to us. I listened keenly when Professor Igi said something about how the hurdles they went through, how they were called to serve, and what they witnessed with the system. And something struck me while he was speaking when he talked about the impediment to the bill, as it were. And he said the critical mass. So I got stuck, because I've always had this feeling that the reason why we are stuck at is fighting for the bill, and I share the same sentiment that we don't have the numbers. So I want to know from him, dear Prof, please, can you shed more light on the critical mass? What you mean by the critical mass? In what context? How does this mass? How would it help in? Would a growth in number help advocate for the bill, and what it means to have this critical mass. What does the critical mass mean for us? What number? If it's possible to put a number on it. And the second question is, what problems will the MP bill, the medical physics bill, solve for the profession? What problem will it solve? So we know what to expect from who, and we know the level of progress we're expecting to make if we have the bill, so that we can know if we can actually achieve some things even without the bill, or we are waiting for the bill to unlock it so that we're not disappointed that we cannot do a lot of things even when we have the bill. So thank you very much for your time, Prof. Thank you.
All right, thank you very much, Victor. I only tried to see your question in the chat box. The critical mass I was talking about here is actually contextual. All right, and the lack of that critical mass, is what informs why the government was trying to assist, at least for those who saw the actual need and the importance of having medical physicists in the health industry. Saw that time that probably it's only the executive bill that can actually assist us in this instance. For example, the critical mass I'm talking about here again, when you look at the radiographers, probably in their thousands, the medical lab scientists, same. But here we are, not until now. Perhaps the 280 that Professor Ogunleye was talking about, that registered on the NAMP platform, sensitization and all that. When you look at how many of these numbers are actually involved in the clinics, probably 50. Certainly not even up to 100. And again here, you can't say that probably all these people that are working are actually competent to do the job. These are some of the issues, because in the initial stage, we have like trying to bring in physics assistant and all that, So you have BSc, what are going to be that's why I really, I like this thing that Professor Ogunleye brought again. If indeed we need to create a pathway, it's a big job for this, so that we don't look at it from just the negative perspectives alone. If people don't have this required number of internship by experience in the hospital, and probably at the time of interview, you ask, what can you do? But this form part of the critical thing during the residency program that went moribund. So people have to, luckily we have to move to Sokoto that time, because Sokoto was the one that has the currently newly installed LINAC. And this to have to calibrate, the energies. They are luckily they're out of the 7. 4 we concluded in Sokoto, and they have to bring out the water tank, set up the chambers and everything. So these are the kind of things that probably we are talking about. Not only the knowledge, the skill to be able to put your hands together and do some of this stuff. Okay. So in terms of 50, all right, or probably just about 50 in the clinic, when we are talking of the actual clinical medical physicists that are of big concern in this situation we are talking about now. But unfortunately, the lobbying system here to be able to push things through. This is the bit I was actually talking about, Victor. So the critical mass is not just about the numbers, right? But the actual number with the wherewithal resources that can actually push things through. I hope that helps. Thank you very much.
Yes, Prof. Sorry, I think the second question is still there.
Thank you. I'm sorry. we may not have time to take much questions. Look at the time, because of time. Do you think questions will be addressed?
Sorry, ESG, the MP bill. Let me just quickly make one remark on that.
Okay.
Yes, the MP bill, medical physics bill, I mean, yes, so that people have expectations. So it's not that probably when you suddenly have the MP bill today, all problems are solved, you know? But to a very large extent, at least we'll have climbed a pedestal, okay? The question of scheme of service that we are talking about, that we don't have scheme of service and we are not being properly designated, you know, scientific, I mean, we have scientific officer 1, scientific officer 2, you know, these are medical physicists, like the radiographers, the lab scientists, they have their own. So the cadre thing will have been properly sorted, you know, with the MP bill, among other issues that will have been properly resolved. So that would be my quick comment on that. Thank you.
Thank you. Thank you very much, Prof. Gim. Thank you, everyone. Dr. Ken, you're muted. Would you like to take?
Okay, all right. So thank you so much, everyone. Obviously, it's been a great time, and I think time well spent. We apologize for shooting beyond the time. You know, there's already 28 minutes on the other side. So on this note, I plead with the president, you know, for the remarks. I plead that maybe that be suspended on her behalf and on behalf of the National Executive Council. I want to give the closing statement. So, distinguished panelists, once again, we thank you for honoring our request. The Board of Trustee members on call, the esteemed colleagues, ladies and gentlemen, on behalf of the National Executive Council, I want to appreciate us for finding time to be part of this meeting today. This is one in the series. Quite a lot of events will be unfolding between now and the conference that comes up in the first week of November this year, our international conference holding at Abuja. So as we bring this enriching discussion to a close, we'll reflect not just on the journey of 40 years, but also on the depth of insight, honesty, and vision shared today. We have heard from our pioneers, that is the founding members. Modupe Oresegun, thank you so much. You won't stop amazing us. Professor Ogunleye, like I said earlier, I won't get tired listening to you because everything you say makes quite a lot of sense. Then other members of the panel were so grateful. So we have heard from our pioneers, those who laid the foundation under the challenging circumstances, and from our frontiers, the pathfinders, including Professor Ige, Dr. Audu in absentia. So those shaping the present and looking boldly into the future. What emerges clearly is that medical physics in Nigeria has come a long way, yet important work still lies ahead. I mean, we are all testifiers to this. We've got quite a lot to do. Key themes have resonated throughout this conversation. First, the need for a stronger unity and internal cohesion. Secondly, the urgency of legislative recognition and structured career frameworks. And at this point, I also feel that everything is not about the money. Yes, we know Nigeria has a very faulty system that the lawmakers would always want to, receive big back. But sometimes certain also come under the presidential bill. If the president takes it to the National Assembly that will know too well, that would approve his request before it gets to the National Assembly, it will be a done deal, having a bill and the SOS. So the next point is that the importance of mentorship and capacity building, it cannot be underestimated. And the critical role of trust, collaboration, and forward-thinking leadership. And that is what the current NEC, promises. It's not about our comfort today, it's about sustainability and about the medical physicists in the future. So every energy is geared towards ensuring that we are building a profession that children yet unborn that will find reason to make profession in medical physics, would meet less hurdles than we are experiencing today. These are not just challenges, they are opportunities, and opportunities for NAMP to strengthen its voice, for professionals to align around shared goals, and for the next generation to build on an even stronger foundation. So as we celebrate this 40th anniversary, we are reminded that institutions endure not just because of their history, but because of their ability to evolve. The future of medical physics in Nigeria will depend on 1, how well we work together, 2, how boldly we engage with policy and leadership, 3, how deliberately we invest in people. And on this note, I also want to crave the indulgence of the practicing senior medical physicists, to be friendly and to also see reasons in passing knowledge and grooming younger ones so that there won't be vacancy, or knowledge gap tomorrow.
Sorry.
On behalf of the organizers, I sincerely thank our panelists once again. Immediate past President, Professor Balogun, your humility is unparalleled. We really appreciate you finding time. And we also learned Dr. J.K. Audu did everything to join the call, including subscribing. That was also part of the reason I had to, log in from 2 devices to avoid being thrown out, without my consent. So on behalf of the organizers, I sincerely thank our panelists for their candor and wisdom, and our audience for your engagement and commitment to the profession. Also, thank you for your time and patience. Let this not be the end of conversation, but the beginning of renewed action. So from the moderators, the ASG and myself, we say thank you and we wish you all a successful continuation of this historic celebration. Thank you once again.
I think the SG wants to make a brief announcement on our upcoming conference, please. Let him quickly do that.
That's fine. Please. Okay, thank you.
Thank you very much, everyone, for such an impactful, mind-blowing session. And I would like to invite everyone far and near from across the world for our 15th Annual Medical Physics Conference. It's going to be an international conference that will bring medical physics across the continent and across the world to celebrate NAMP's 40th anniversary, 1986 to 2026. And this conference will be holding in Abuja, Nigeria, the capital of Nigeria. And we hope that every single person that is on this call will register. On the 1st of April, announcements will be made for the call of abstracts, and registration for the conference would officially open. And would enjoin everyone to be part of it. And we look forward to seeing you all in Abuja. Thank you so much.
Thank you. SG, can you also tell us about membership, how those who are not members and are on the call, how they can become members of the association so that we can increase our, is it increase or improve our critical mass now? So please let us tell them that we can.
So to become a member of the association, please just go to the website. It's namp.ng. And the particular URL you're looking for is namp.ng/membership. All the information that you require to be a member is there, whether you want to be a student member, associate member, or a full member, whatever category, there is something for everyone. So please, if you're a graduate of physics, then you can definitely become a member of the Nigerian Association of Medical Physics. Please go to namp.ng. We're going to type it on the comment section again, namp.ng/membership. Thank you.
Thank you. We didn't take a picture. We're supposed to take a picture.
Yes,
we didn't take a picture with our panelists. This is, we had the opportunity of bringing together the Irokos, the medical physics Irokos from outside the country and within the country, and we didn't take a picture.
Can we all
So
turn
I'll
on our
stop
video?
sharing. Okay.
And I'm sure most of them would have left the call. I can still see Professor Ojoegbe, Dr. Oresegun, Professor Ige, and I don't know if Professor
Tom is
Ogunleye is
still on
still
call,
here.
so.
We'll take care of it.
All right.
Okay. Cool. I guess we are done, yeah. We're good.
Nice one.
Thank you, everyone.
Thank you, guys. Thank you.
Thank you. Thank you, everyone. It was good to have everyone on board. Thank you for joining. We'll see you again next time. Have a great day.